So good morning, everyone, and thank you for joining the Berkshire East GSNA webinar, which is being jointly delivered by the 3 local authorities public health team in East Berkshire and Berkshire East Public Health Hub. Please note that we will be recording today's sessions, which will be available on the GSNA website for later reference, and for any of your colleagues who are unable to attend today. Just a reminder that we will be muting everyone apart from the speakers and request that you keep your cameras off, please. Today's presenters are myself, Dr. Vanita Datta. I work as a public health principal for Slough Borough Council, and I'm the GSNA lead for Slough. Shamaki SA, Public Health Program Officer, Public Health Intelligence for Bracknell Forest Council and GSNA lead for Bracknell. Dr. Mark Connor, GSNA lead for RBWM, and last but not least, Becky Campbell, our Public Health Intelligence Manager, Berkshire East Public Health Hub, and April Otong, who is going to help us from the Public Health Informatics. She's an analyst and would help us in the polls today. In today's webinar, we will be covering the following content: the context and importance of GSNA and setting the scene in local context, followed by a live demo to explore the current content of GSNA and navigation. We would then move on to a live example to demonstrate how the GSNA can be used by the stakeholders and the commissioners. Lastly, there would be a question and answer session covering frequently asked questions, and we will encourage all attendees to add questions into the chat function. These will be picked up at this session. If for any reasons we are unable to answer any of your questions during the session, we will be uploading the responses to them on the GSNA website under help section. So without further ado, let's move on to what and why of GSNA. The local authorities and the integrated care boards, ICBs, have a joint responsibility to assess the current need in terms of the health and well-being of the community they serve. It should be used by the providers and the commissioners to plan and target the services in an area. After the recent implementation of the Health and Care Act 2022 on the 1st of July 2022, development of the GSNA still continues to be a statutory responsibility for the health and well-being boards of the local authorities. Now, nothing has changed in terms of the responsibilities and how we operate after the Health and Care Act has been implemented. The joint local health and well-being strategies should be based on the priorities which are identified through the local GSNAs and should be clear and available to the public. I would like to draw attention to the 2 documents at the bottom of the slide for reference and further reading. It has got all the updates in relation to the new Act and the GSNA. So next slide, please. So getting on to the Berkshire East approach, the 3 local authorities in Berkshire East sit under the Joint Director of Public Health, Stuart Lyons, and are part of the Frimley ICS footprint. We work collaboratively through a steering group to develop the GSNA together. This has allowed us to assess the health and inequalities across Berkshire East, but also share learnings with each other. Parallelly, we also acknowledge that there is a need for the local data and mapping inequalities for priority setting locally and use of the commissioners in the place areas. Hence, the GSNA website has 3 different tabs for each local authorities, which you will see later on in the demo session. Moving on to the GSNA progress so far. Next slide, please. The Berkshire East GSNA website was launched on the 30th of June this year and is available at the following link on the slide. I would encourage, if you've got 2 screens or if you can manage, then please go onto the website and play around as the demo is going on for better understanding. The website has been shaped and constantly evolving with your feedback. There's a "you said, we did" document which has been added to the website to summarize the feedback that we've received and the changes that have been made. A communication and engagement plan has been developed to publicize and make the resources accessible to all our stakeholders, including our community voluntary sectors across the 3 local authorities. And I think the success of a GSNA is as much as it is used. So we really hope that from this demo, you will not only learn, but also share with other colleagues who can't be present today. We were very pleased with the number of views that the site received within the first week of the launch, which was around 400 views. And although a how-to guide has been added to the website to support the user navigation of the website, but we hope that the webinar would further support you in accessing and using the GSNA.
As part of this section of the webinar, I will be providing a quick demo of the website, just going through some of the main pages and resources to help you get the most out of the website. The JSNA website is hosted on the berkshirepublichealth.co.uk website, along with a number of other resources, such as the Berkshire Observatory, Healthy Berkshire, and Safe Sex Berkshire. In order to access the website, you can either go on berkshirepublichealth.co.uk and click on the Berkshire East tile, or by visiting berkshirepublichealth.co.uk/JSNA. So if you click on here, or if you go to the website, you'll end up with the homepage. The homepage has a very nice animation, and if you scroll down, the 2 main parts of the homepage are the welcome message, which describes the resource. If you scroll down under what is a JSNA, you will be provided with a short explanation of what the JSNA is, particularly useful for individuals who are not familiar with what a JSNA is, as well as if you scroll a little bit further down, you'll also get links to the Berkshire West JSNA local authority pages. On the right-hand side, another very important part of the homepage is the latest news section. So in this section, any new updates, including any new resources added to the website will be listed here. So whenever you do visit the website, keep an eye out on this section for any new topics, packs, for example, health needs assessments or other resources added to the page. So the website is split into 4 main sections that can all be navigated through the menu bar at the top of the homepage. The main resources of the JSNA can be navigated via the topics drop-down menu found here. So in terms of the individual topics, you've got overarching, which is the section that includes the latest people and place summaries, health and wellbeing strategies, health needs assessment, and other resources for the individual local authority. So if you were to click on here, you'd end up on this page. And if you wanted more information for the individual areas, you can just sort of click on read more to get more information. The other important parts of the website are the main topic sections of the JSNA, namely people, place, health behaviors, life stages and groups, and disease conditions and healthcare. Our initial focus was to develop the health behavior section, so I'll be going through the topic packs in this section to give you sort of more sort of familiarity with the website. So by clicking on health behaviors via the topics menu, you'll end up on the health behaviors page. So each topic section is, regardless of the individual topic selected, is structured in a similar manner with a brief explanation at the top about the individual section, the individual topic pack sections linking you to the individual topic packs for each LA, and at the bottom of, so for each individual one. And if you wanted to have some more information about the specific area, so in this case, I'll be using an example of healthy weights, you can click on read more to go into this individual area. But similarly, because we have topic packs for smoking and substance misuse, drugs and alcohol, you can also click on read more here to go into more details. But for this demo, I'll be using healthy weights. So by clicking on read more, you'll end up on this specific page. So the topic packs provide a more detailed look at the topic and include the latest data, trends, inequality, and a summary of the current services, gaps, and next steps at local authority level. At the bottom of the page, we have the useful resources section. This is the library of resources for the subject area and includes national guidance and policies, as well as locally produced analyses such as health needs assessments. The type of resource can be filtered by selecting on the geographic area, so Bracknell Forest, for example, or by using the drop-down filter menu. So as we move on to the main part of the website, which is the specific Power BI topic packs for the individual areas, I'll be using healthy weights as in Bracknell Forest as an example, as I am the representative for Bracknell Forest on the JSNA steering group. So in order to access the topic packs, you click on View Topic Pack, and what you will get is a Power BI page that you will get with all the information for that specific area. You do not need to have access to the Power BI program or access to any licenses, because this is all hosted on the website. You're able to just go into the pack and navigate the individual pack and use the resources. So if we have the individual topic pack, and I'll go into full screen just so that everyone has a better look. You have the front page, which includes an introduction of the topic and its importance on the left-hand side over here. On the right, you have the individual topics that make up a specific topic pack on the right. In order to access those pages, you can either click on the individual topics of interest, so for example, excess weight in children, or you can navigate the pages using the arrow buttons at the bottom. So if you wanted to go through each individual page, you can just sort of click on next page, and previous page will appear as you go through the pack. So as our example, we'll be going through excess weight in children in Bracknell Forest. So what I would do is I'll click on the pack, and what you'll provide is, what you'll see is a description of the topic and a short summary, including the main data points. You'll see a very nice map as well as charts. The data displayed in these maps and charts are linked to the individual indicators for this specific topic section. So as I go through each individual radio button for an individual section of interest, so for example, you're interested in the prevalence of overweight, including obese children in reception, you'll see the data change as I go through these individual indicators to represent the data linked to this indicator. If you were interested in, for example, looking at a specific data values within either the charts or the maps, you can hover over the particular area. So if you're interested in knowing what the prevalence of overweight and obese children in Bracknell Forest was in Ascot, you just find Ascot on the map, you hover over it, and hopefully you're able to see that. You'll get a data call out with the area name, as well as the value for that specific indicator during that time period. So in this case, 17.24%. Similarly, if you go to other areas within the map, so Binfield Warfield, 22.03%. If you wanted to highlight a particular area on these different maps, on the map and the different charts, you can click into the area. So as you can see, what's going to be highlighted here is the Binfield Warfield, or you can also, within the actual chart, select a specific data point to get more information. If you are interested in getting the underlying data for a specific indicator, what you can do is right-click into the map or into the chart, select Show as Table, and as you can see here, you will have the information related to that indicator for the area of interest, in this case ward, as well as all the other ones. So if you wanted to, for example, copy this to a report, you can so very easily access it here. To go back to the report, just click on the Back to Report page, which takes you back to the page. As mentioned earlier, if you wanted to sort of navigate through the different topics, you can just sort of select to click on the next page button, which takes you to the next topic, so excess weight in adults, for example. And similarly, it's all very interactive. You can sort of select into different areas. You can select different data points, right click, show as table, with also the explanation on the left-hand side. And you can that way you can sort of go through each of the individual topic areas of interest until you get to the last few pages. So this is the page that has the local next steps and recommendations to tackle the outcomes for that specific topic sections, all the way down to sort of each individual page. If you wanted to go back to the front page, you can sort of very easily select on back to first page, or you could select in the drop-down menu, which takes you back to the front page. To exit the pack entirely, you can just quickly just go to leave the full screen and go to back to healthy weights. The next important section is the help section. So by clicking on help in the menu area at the top, end up on the health page. So the help page has a number of important components. The first would be the most frequently asked questions listed below in our FAQ section, along with comprehensive answers to those questions. These can be accessed by clicking into the question and then sort of reading through the explanation. There's also a brief guide to support your use of the website, which can be found over here, which includes website structure, navigation guides, as well as any tips for using the topic packs, which can be accessed here. There's also a glossary of terms, so any terms that are frequently used, individuals might not be completely familiar with or would like more information on. In a similar manner, you can select on the glossary of terms. So if you wanted to know what exactly is meant with inequality, click on inequality, and you'll find an explanation of that specific term. One other important bit under help that I would like to draw your attention to is how we've responded to your feedback in the consultation period. So under the how has feedback helped to shape the Berkshire East JSNA, you will find a link to a report called the You Said We Did report. This specific document includes all the improvements made to the website as a result of the feedback we received during the consultation period. You're able to access that specific report by clicking on the link, which will then take you to a Word document, and it gives you a background of the JSNA consultation as well as the individual feedback we've received. So in the case of website contents, it tells us that there was a need for an overarching document, an area where the overarching documents could be easily found, and it sort of explains the work done by the Berkshire East Public Health Shared Hub in actually addressing that specific comment. Going back to the page, the next important bit is the Contact Us area, which can be accessed here, and will take you to this page. The Contact Us area includes sort of a short feedback form. So if you have any questions, queries, or feedback about the JSNA, you're free to, we'd actually sort of really like if you complete this short feedback form. So by entering your name, your email, the subject, and your message, or alternatively, you can directly contact us by sending an email to berkshirepublichealth@brackenforest.gov.uk. The last part of the website I'd like to sort of talk you through is the useful links section. The useful links section includes links to the Berkshire Observatory, the public health page for the 3 local authorities, and the Frimley ICP website, which can be accessed by just clicking onto here. And if at any point navigating the website you want to go back to the home page, there is the JSNA Home button.
So this final section of the webinar is to answer your questions. And so we're going to start by looking at those questions that have been pre-submitted. But if there are any that you've got now, please do put them in the chat. I'm more than happy to try and answer those as we go through, or to pass over to other members of the steering group to be able to answer. And as Vanita said, if we don't get a chance to answer all of them now, we will take them all away and come back to you with an answer and put those onto our website. Shamake showed you the help section of the website, and that has got frequently asked questions on it and a glossary of terms. We're really keen to keep expanding and developing that. So as questions come in, it's really helpful for us to be able to add them on there, so that hopefully we're not just answering your question, we're answering other people's too. Okay, so the first question that we've had come in is, so what's the difference between the Berkshire East JSNA website and the observatory? And I think both Shamake and Mark have shown this through their presentations today. But in summary, the Berkshire Observatory is just one element of the overall JSNA. And the observatory has been in place since about 2018, 2019. It was identified at that point that there really needed to be a central place for people to go to get data about thousands of different indicators, to enable them to answer some of the questions that they may have as they're getting on writing policies or putting in bids. The downside to the observatory is that it doesn't include any interpretation or narrative. So while it's really useful, it doesn't have that additional information that you might need, and it also doesn't pull together what's happening across the Berkshire East patch. So we're hoping that by providing the JSNA website, which the observatory is a part of, as part of the puzzle, we're helping to enable people to access a range of tools that can aid decision making or identify gaps that might need to be addressed. Next question that has come in, and this one comes in a lot. There are a lot of gaps on the JSNA website. When will it be finished? So it will never be finished. The JSNA is a process. It's not a published document that's got a timestamp on it. So it is forever evolving, forever developing, and importantly, things are taken off it as well. It's not just a place that we just keep adding stuff. It's constantly reviewed to make sure that we've got the latest available evidence and information on there. So it will, as I said, it will continue to evolve over time. What we see the website as being is a bookshelf. It's the structure to put all that information together. So we're really pleased that in June we finally got that bookshelf built and it's now out there with everybody to use. What we now have to do is continue to add the books and the resources into that bookshelf. So you'll see that there's some already on there. In particular, we focused on the health behaviour section of the website as a starter, and then now all of those have topic packs attached to them that gives you the detail and the recommendations that have been agreed for those areas. But what we're doing as a steering group is continue to prioritise what sections need to be updated next. So we're currently working on the mental health topic packs. There'll be one for adult mental health and one for children and young people mental health. And then we're also going to be specifically looking at the topic packs that are around inequalities and disadvantaged groups, as we recognise that that's an area where a lot of people often want to get more information. So those are our priorities at the moment. And the prioritisation of the work that we decide to do next is very much based on the focuses within your joint health and wellbeing strategies across Berkshire East, and also discussions that happen at different levels of our organisations where there is identified that there really is a priority where we need to find out more. So the prioritisation process is a continual thing. And is something that we really need to decide as a system. It's not just a few of us sat on a cupboard somewhere making it up ourselves. Next question is about the census 2021 information. So when will that be added to our JSNA website? Well, the census happened in March 2021, and very recently, I think it was towards the end of June, the Office for National Statistics started to release some of the data that was coming out of the census. At the moment, that's at a very high level. So it's a kind of a local authority or region or national level, looking at population by age groups essentially, and also there's household figures that are out at the moment. But we recognise that the census data is key to practically everything that we're looking at, so that we can really understand the population as it is now. So again, this is an area that we're committed to continually updating on the JSNA as more information comes out. There is an analysis of that latest census data that I've just mentioned on the Berkshire Observatory, and there's a summary at each of the local authority levels showing what the kind of the general population is. And we're going to also be putting on to the main website some kind of one-pager narratives about how the population has changed since the 2011 census, and also how it may have changed over the time that we've had the mid-year estimates. More information about the census will be put particularly on the people and the place sections of the website. Next question that we've had come in is, how do I know when a new chapter is added or updated? So Shamake showed you the latest news section on the homepage, and that's where we'll be putting alerts to new sections that have been completed. So that's always a great place to go when you go onto the website if you haven't been in a while. We will also be making a real point of letting people that need to know about these new packs know. So we've got quite a long list of colleagues across our organisations that we will let them know when that's, for instance, when the mental health packs come out or when specific packs about inequalities come out. So you'll probably hear about it in a number of different ways. We're also planning to have a schedule of topic packs, and I'm pleased there's somebody, Giovanni's put that question in the chat here. So it's really important that people know what we're doing and when, so that you can be prepared for things coming out. And we're planning that we'll be producing a schedule of topic packs so that you can see what we're working on and what's planned for kind of the next 6 months at least, so that it gives you an idea of what to expect and when. Right, this is the important question, I think. So how will local professionals be asked to inform the JSNA, and how can I get involved? So as Vanita said at the very start, the JSNA is pointless if it's not being used. And that was one of the main reasons why this website was put together, so that there was a central resource that people could go to, so that it will then inform any decision making that is being done and can help to identify gaps. So the JSNA process, as it has been up to this point, getting the website live is kind of now completed, that stage of the process. We're now reviewing that to really think through how we best ensure that the right governance arrangements are in place to identify people that should be involved in the development of the different topic packs and resources that are put on there, because it's key that we get the input from local experts to inform what we're doing, because there will be a lot of valuable insight that we're never going to be able to find just by looking at numbers on a page. It's kind of really understanding that local intelligence to be able to understand what the recommendations and next steps should be. So it's essential that as many of us are involved in that process as possible. So as I said, that process of how we do that is currently under review. The steering group up until this point has been very public health focused. There's been reps from each of the local authorities as well as our hub teams, but we're keen to expand that to include other local authority officers not within public health, and also, really importantly, to include our colleagues within the ICB. So we think there will be an overarching steering group carrying on to oversee the whole JSNA, but really importantly is where the work gets done. So there'll be lots of little task and finish groups that are set up to be working on specific packs along the way. So if there are any specific sections of the JSNA that you'd like to be involved in, please do email us to let us know. So at the end of this presentation, we'll give you the contact details for the relevant leads within the local authorities, and there's also us within the hub team as well. So we will very much be reaching out to you, but also if there's something that you really feel you need to be involved in or you need to be making us aware of, please do contact your leads. And I think this is the final pre-submitted question. So how can we include information that we have analysed and created? So we went through a stage of deciding what resources needs to be on the website when it went live. And that was a mixture of national resources, regional resources, and also those that we've pulled together at a more local level. So there are health needs assessments on there which cover the whole Berkshire East footprint. There's also really specific pieces of work that have been done by the local authorities that are looking at just their local authority, or equally just a place within that local authority, just a ward. It's all relevant stuff. So that's what's on there at the moment. We, as part of this new JSNA process I'm talking that I've mentioned previously, we want to be looking at how we best ensure that we are capturing everything that is being done by the system, and that we're also putting things onto the website that are appropriate and relevant. So if you have any relevant finalised work that you think would benefit being on the JSNA, would be a place for people to go to access it, then please do again contact your local authority JSNA lead or our hub team. It needs to be relevant, obviously, so that any relevant work really is work that shows decision making or a needs analysis to improve the health and well-being of our local population. It also needs to be accessible. So that's both in the way it's written in terms of the language used, but also about the formats that it's in as well. So it needs to be something that is an accessible format on the website. And if you've got any questions about that, please do contact us and we can talk you through that. And then very importantly, it is a public website, so it is something that anybody could access. So the resource would need to not include restricted data or any confidential information that wasn't appropriate to be shared publicly. So that's how that information can then be added onto the JSNA. Right, I think that's all the questions that have come in so far. So I'm just going to run through what's come in from you all to see if I can answer any. So yes, absolutely, you can have a copy of the slide pack. We will be putting that onto the JSNA website, but I'm also more than happy to send this out to people. I'll be able to see from the attendance list who's come in. Oh, thank you for all of your really positive feedback. Is there a schedule? Yes, I've been through that one. Mayor, I'm just coming to yours. Yes, so you were asking about the RAG rating that's being used in the topic packs. So it was decided at the steering group that we would use kind of quite a generic RAG rating system that is familiar with using a lot of the fingertips profiles. So we are comparing to the national comparator. So that shows whether we are, as Mark mentioned, we're significantly worse than the national comparator. We are similar or we're significantly better. It's not perfect by any means because national is sometimes not the comparator that we would choose to use, but it just, I think, gives us an idea of where we're at. You would have seen in the topic packs that Shamake showed, I think it said least deprived decile on his because he was showing a Bracknell pack. Bracknell Forest is in the least deprived decile in the country, so that's why we've added that additional comparator group in there so that you can see how the local authority compares to the deprivation decile that it sits within, as we know that deprivation is such a key measure of how of health outcomes within that. So that's the same for the Bracknell and for the Windsor Maidenhead pack. For Slough, it's different because Slough's in a different deprivation decile. So the Slough RAG rating charts, you would see Slough's information against the relevant deprivation decile. So I hope that oh yes, I was going to say I hope that makes sense, and you've put yes, makes sense. Brilliant, thank you. Are there any other questions that anybody's got? This isn't your last opportunity. You can see now on the screen there's the contact details of those of us on the steering group that you are very welcome to contact. But I will give it a few seconds. If there's no more questions, then I suggest we go on to the poll. Nope, no one's typing. Okay, thank you. The poll then. So thank you, April. We just got a few final questions for you. How useful did you find our webinar today? Please be honest. This is really important to us because we're trying to find good ways of engaging and communicating with people. So it'd be really helpful to know. Thank you. Well, thanks, everybody. That's a really positive response. April, can we have the next one? There you go. So we'll use the website more often after this webinar. That's what we wanted to see. So that's great. Thank you. Next one, please, April.
I think that's it, Becky.
Oh,
That's the
I
last
should have known,
question.
really, shouldn't I? No problem. No, thanks, April. If you've got any feedback or any comments that you wanted to make about things that you think you might like to know more about, or areas of the website that you would like us to look into in a bit more detail, please do put it in the chat. we will capture all of that, and it will really help us to inform what we're doing going forward. So I think looks like that's probably it. So I'd just like to thank all of my fellow presenters today. They've been members of the JSNA steering group all the way through, so it was an achievement to get it launched, but I think it's really exciting about what we're going to do going forward. So thank you all very much, and thank you for attending as well. It's really encouraging to see so many of you here today. But I shall say goodbye. Thank you very much.